Increasing the rate of comprehensive foot exams in patients with diabetes mellitus utilizing standardized documentation. Introduction. Diabetes mellitus causes peripheral neuropathy and peripheral arterial disease, leading to foot ulceration, infection, and subsequent amputation. The American Association, or ADA, recommends annual comprehensive foot exams for all patients with diabetes mellitus to prevent these complications. Retrospective chart review revealed lack of uniformed diabetic foot exam documentation at Truman Medical Center, and none of the exams were comprehensive. Our quality improvement aim was to standardize the documentation of diabetic foot exams and increase the rate of annual comprehensive foot exams from 0% to 50% in adults with diabetes mellitus over the course of 3 months. Methods. A comprehensive foot exam form was added to the annual diabetic foot exam health maintenance reminder in the electronic medical record, or EMR, to standardize documentation. We showed residents this EMR form and discussed what makes a foot exam comprehensive via posters in resident workspaces, presentations at 2 resident lectures, and weekly emails to those attending clinics during the last 5 weeks of our 9-week intervention. We included patients with diabetes mellitus aged 18 years or older seen in Truman Medical Center Health Sciences District Primary Care Clinic by an internal medicine resident for in-person follow-up between December 1st, 2020 through February 28th, 2021. We excluded patients being seen for inpatient or emergency department follow-ups and urgent care visits, as chronic condition screening is out of the scope of practice for those focused visits. Results. 0 patients had comprehensive foot exams pre-intervention. During our intervention, 21 patients who met our inclusion criteria were due for their annual foot exam. 2 out of those 21 patients had a documented foot exam. 0 of them were comprehensive, and 0 patients had the foot exam form completed. Discussion. Our intervention had no effect on the number of comprehensive foot exams completed, and our standardized documentation form was not utilized. Based on our results, we are not only missing components of foot exams required to make them comprehensive, but we are also missing foot exams entirely when they are due. 9.5% of patients due for a foot exam had one completed when presenting for a routine chronic condition follow-up. This is an additional area for future improvement efforts. We had several limitations to our quality improvement project. Our clinic building relocated to a new location, University Health, and that building did not allow for our posters to be hung, which would have provided more frequent reminders. Our residents rotate through clinic weekly, so each resident had about 5 to 10 half days of clinic during our intervention. A longer study time with repeated education may increase the number of comprehensive exams completed and documented. We believe that many patients who met our inclusion criteria were missed during the data collection because our group members were performing comprehensive and utilizing the tools, but those patients were not in the data provided by information technology. We would like to thank Truman Medical Center and University Health, where our project was run. We would like to thank the Quality Patient Safety Day Committee for allowing us to present our quality improvement project today, and thank UMKC School of Medicine for hosting. We have no disclosures, and our reference is the American Diabetes Association Microvascular Complications in Foot Care, Standards of Medical Care in Diabetes Guideline. Thank you.